Hi everyone, Liz Debut here. This is my video submission for the genetics discussion. My best friend has met me for lunch and she just told me that she took a genetics home test and she was told that she is possibly predisposed to type 2 diabetes and she's not happy about that. So I'm going to reply to her with some talking points that I've came up with. Um, First off, that is scary to hear something like that, so I empathize with you. You're not wrong to be concerned about the possibility of being predisposed to type 2 diabetes. Um, it's a serious health concern and it can have major complications for the affected person. I would suggest that you remain calm and just try to understand what it means to be predisposed to a disease. It just means that you have a certain degree of risk for developing that disease, but it's not 100% certain that you will develop the disease. And it's great that you don't eat sugary foods. It takes a lot of willpower and self control to avoid those things. Also, I think it would be smart to question the validity of the genetic home test because the results could be incorrect. Uh, the test can tell you that you're predisposed to a certain disease, but the results of these genetic home tests are not indisputable. So, they're not conclusive because there are other factors that lend to uh, the possibility of developing the disease, such as lifestyle and some other things. Uh, Having type 2 diabetes means that you have a high concentration of glucose in your blood, and that's known as hyperglycemia. It can be caused by problems with the production of insulin or the action of insulin, or both. Insulin is basically needed to unlock the cells to allow the glucose to enter to provide energy for the body. So, it's very important. Risk factors linked to type 2 diabetes are a family history of diabetes, cardiovascular disease, obesity, a sedentary lifestyle, smoking, aging, ethnicity, and high blood pressure, which is also known as hypertension. Um, if a person develops type 2 diabetes and it's left untreated, they can be prone to having heart attacks, strokes, circulation problems, which can lead to amputation of a limb. They can also have damage to their eyes, nerves, and kidneys, and also nerve damage in their feet that's known as neuropathy. I would advise you to make an appointment with your primary care doctor to discuss your concerns. Type 2 diabetes is really prevalent around the world. Uh, so when you meet with your primary care provider, they will take a thorough history and physical. They'll ask you questions about your family history and then also questions about symptoms that you may have been experiencing, such as an increase in thirst, increase in urination, fatigue, infections that can be both viral or bacterial, and blurry vision. They'll also order a lab test called a glycated hemoglobin A1C, and that measures your average glucose levels for the past 2 to 3 months. And typically, if it's 6.5% or higher, you would be diagnosed with type 2 diabetes. Your primary care provider will also talk to you about maintaining a healthy weight and eating a healthy diet, as well as getting plenty of exercise. You definitely would be advised to avoid foods that are high in sugar, high in sodium, and high in cholesterol. So it's good that you're already avoiding sugary foods. Your practitioner will also talk to you about monitoring your health and what testing will be needed and how often you would need to be screened. So hopefully this will help you feel more comfortable just getting some information on the topic. So go see your primary care provider. All right, thank you.